What does it really take to survive in modern America? Not just scrape by, but actually feel safe. Imagine this. You wake up one morning with a steady job, health insurance, a car, maybe even a house. On paper, you're doing fine. But then your child gets sick. The doctor's visit is covered mostly, but the specialist isn't. The prescription is expensive. You miss work. The rent is due. Suddenly, that stable life starts cracking at the edges. 1 month turns into 3 of falling behind. That safety net you thought existed? It slips through your fingers like sand. How can someone earning what most would call a good salary be just one emergency away from collapse? Welcome to the hidden reality of what people are now calling the kill threshold, a term borrowed from video games, where a character above a certain health level can survive attacks but drop below it, and even a basic move finishes them off instantly. In real life, this isn't about hit points, it's about dollars. And for millions of Americans, crossing that invisible financial line means losing everything: home, credit, dignity, faster than they ever thought possible. Now, think about how we define poverty. Officially, the U.S. government says a family of 4 living on less than about $32,000 a year is poor. But try feeding 4 people, paying rent, covering transportation, childcare, and medical costs on that amount even in a small town. It's impossible. That number hasn't changed much since the 1,960 seconds, when economists estimated that families spent 1/3 of their income on food. So they tripled that figure to set the baseline. Sounds logical for 1,965. Today, most families spend far more on housing and healthcare alone than they do on food. Childcare in many cities costs more than rent. A single hospital stay can wipe out years of savings, even with insurance. So, what if the real survival line isn't $32,000, but closer to $140,000? That's the number some analysts have started pointing to, not as luxury, but as the minimum needed to avoid total breakdown in high-cost areas. This isn't about vacations or designer clothes. It's about being able to fix your car without panic, see a doctor without checking the price first, or save even a little for retirement. At $100,000, many families still live paycheck to paycheck, not because they overspend, but because the cost of simply staying in the game has skyrocketed. And here's the twist. Sometimes making more money makes things worse. Let's say a single parent moves from $40,000 to $70,000 a year. Great, right? But now, they no longer qualify for subsidized childcare, Medicaid, or housing assistance. Overnight, their monthly bills jump by thousands, while their take-home pay only rises by hundreds. They're punished for succeeding. Economists call this the benefits cliff, a trap where progress feels like falling backward. This isn't an accident. It's built into the system. Over the past 50 years, wages have barely climbed, but the price of essentials has exploded. Why? Because sectors like housing, education, and healthcare aren't driven by free market competition. They're dominated by powerful institutions, landlords, hospitals, universities that face little pressure to lower prices. Meanwhile, automation and global trade have kept factory jobs cheap, but haven't lowered rents or surgery bills. This imbalance has a name: Baumol's cost disease. In simple terms, some jobs can't get faster or cheaper no matter how much technology improves, like teaching a child or caring for the elderly. So their costs keep rising, dragging down everyone who depends on them. The result? A growing number of households exist in a state of constant fragility. Not poor, not rich, just one missed check, one layoff, one diagnosis away from disaster. And when that moment comes, help rarely follows. Banks don't restructure loans out of kindness. Landlords don't pause evictions for good behavior. Insurance companies deny claims based on fine print. The system doesn't ask if you tried hard, it asks if you can pay. And if you can't, the machinery moves quickly to cut you loose. Some might say, just save more, spend less. But that advice ignores reality. For many, there's nothing left to cut. Cutting the grocery bill means eating poorly. Skipping the car payment means losing the job. Delaying medicine means worsening illness. There's no slack in the system, only tension. And yet, this isn't inevitable. Other wealthy nations handle these risks differently. They treat healthcare as a right, not a product. They cap childcare costs relative to income. They strengthen tenant protections and unemployment benefits. These aren't handouts, they're stabilizers. They prevent small setbacks from becoming lifelong downfalls. So, what's the takeaway? That poverty in America today isn't always about laziness or lack of effort. It's often about structure. The rules are written in a way that rewards stability only if you already have it and punishes anyone who stumbles. The kill threshold isn't a metaphor. It's a warning sign. If your finances dip below a certain point, the system won't catch you. It will accelerate your fall. We like to believe that hard work leads to security. But for too many, the truth is different. You can run as fast as you can and still find yourself sliding toward the edge. The real question isn't whether you're earning enough. It's whether the floor beneath you is solid or just one crack away from giving way.